An ischemic stroke occurs when a clot forms in a partially blocked artery. Part of the clot breaks off and travels into the arteries supplying the brain. When the clot becomes lodged in an artery in the brain, it cuts off blood supply to part of the organ, destroying brain tissue and causing neurological damage. Another type of stroke, hemorrhagic stroke, occurs when an artery in the brain bursts, causing blood to flow into the brain. Amyotrophic lateral sclerosis, or ALS, is a progressive disease that kills neurons of the motor cortex and peripheral motor nerves and inhibits normal muscle control. One cause of ALS is excitotoxicity. The excitatory neurotransmitter glutamate accumulates in the synaptic cleft and overstimulates glutamate receptors. The overstimulated receptors allow calcium ions to flood into the neuron. While normal influxes of calcium are involved in neuron signaling, this excess amount can trigger apoptosis, or cell death. Without signals from healthy motor neurons, normal muscle function ceases, causing spasm, weakness, and muscle death. This commonly leads to impaired movement and speech, trouble swallowing, and eventually respiratory failure. Epilepsy is a neurological disorder characterized by recurrent seizures, which result from disruptions to the brain's normal electrical activity. An imbalance of excitatory and inhibitory neurotransmitters can generate excessive firing of action potentials. Hyperexcitability leads to overstimulation, which can spread to surrounding regions. Different forms of epilepsy produce different types of seizures. In temporal lobe epilepsy, the most common form, stroke or hypertension can damage hippocampal neurons, causing remaining neurons to become more excited. This can produce focal aware seizures with altered hearing, sight, and speech, or focal impaired seizures with impaired consciousness and repetitive movements. This is a neurodegenerative disorder that causes a progressive loss of fine motor movements. It is marked by decreased levels of dopamine in the brain. Normally, dopamine produced in the substantia nigra triggers excitations and inhibitions that refine movement signals between the basal ganglia and the cerebral cortex. In Parkinson's disease, clumps of proteins called Lewy bodies aggregate in the substantia nigra and destroy dopamine-producing neurons. The resulting decrease in dopamine sent to the basal ganglia can lead to difficulties initiating movements. This can lead to tremor, impaired balance and gait, and muscle stiffness. The disorder can also affect bladder function, speech, mood, or higher cognitive functions. While the lungs are normally safe within the thoracic cage, chest trauma can result in a puncture or tear in lung tissue. Air flows from the tear in the lung and enters the chest wall, pushing on the outside of the lung until it collapses. This is called pneumothorax.
Gastroesophageal reflux disease, also called GERD, is a chronic disease of the digestive system. GERD usually occurs when the lower esophageal sphincter, a muscle at the end of the esophagus, does not close properly. This allows stomach acid to leak back or reflux into the esophagus and irritate it. Symptoms include heartburn, regurgitation, and the ability to taste stomach fluid in the back of the mouth.
Peptic ulcers are lesions in the mucosal layer of the upper GI tract, usually in the stomach or duodenum. Aspirin, alcohol, and other irritants may increase risk, but the most common cause is infection from Helicobacter pylori bacteria, also known as H. pylori. The infection first inflames the mucosa. Toxins then liquefy the thick mucus that normally protects the stomach and duodenum, while also increasing acid secretion from the organ's cells and glands. The increased acid penetrates the liquefied mucus and digests part of the mucosa. The damage can inhibit mucus-secreting cells, leaving the area more vulnerable. Further digestion can deepen the ulcer to the muscle layers or perforate the GI wall. Symptoms of peptic ulcers include pain, indigestion, and nausea. Severe cases may involve GI bleeding and obstruction.
Your gallbladder stores bile, a fluid made by your liver that aids in digestion. Gallstones are pieces of solid material that form in the gallbladder when substances in the bile harden. They range in size from a tiny speck to the size of a golf ball. Gallstones can block the flow of the fluid through the bile ducts. Signs of a gallstone attack may include nausea, vomiting, or pain in the abdomen, back, or just under the right arm.
Large intestine, or colon, forms feces, and as people age, certain conditions may develop. Diverticulosis occurs when small pouches form in the wall of the large intestine. Most people with diverticulosis don't have symptoms. It is often found through tests ordered for something else. When feces get trapped in the pouches and bacteria grow, inflammation and infection result. This is called diverticulitis. Large intestine, or colon, is where your body forms feces. In some cases, healthy tissue can become diseased. Ulcerative colitis is a disease that causes inflammation and sores, or ulcers, in the innermost lining of the colon and rectum. Ulcerative colitis is one of a group of diseases called inflammatory bowel disease. It is a chronic condition and is characterized by alternating periods of flare-ups and remission when the symptoms of the disease The lumbar spine bears the weight and stress of the body. As a result, disc herniations can occur, which affect spinal nerves. The sciatic nerve, which starts at the lower back and travels down the back of the leg, is often affected. When a disc herniates, it can pinch the nerve. This is a common cause of sciatica. Sciatica typically affects one side of the body with mild to severe pain, muscle weakness, or numbness felt anywhere along the nerve pathway.
Hemorrhoids are often caused when people strain to have a bowel movement. Hemorrhoids occur when veins around the anus or lower rectum become swollen and inflamed. They can develop either under the skin around the anus as external hemorrhoids or inside the anus as internal hemorrhoids. Straining or irritation when passing stool can damage a hemorrhoid surface and cause it to The rotator cuff is a group of muscles and tendons that surround the shoulder joint. These muscles keep the top of the upper arm in the shoulder socket by forming a cuff that not only holds the arm in place, but helps it move in various directions. Gradual degeneration due to repetitive overhead motion or a sudden traumatic event can tear one of the muscles or tendons of the rotator cuff. Symptoms of this injury include pain, decreased range of motion in the shoulder, and muscle weakness. Lateral epicondylitis affects the muscles of the forearm that join on the lateral side or outside of the elbow. This condition is also called tennis elbow because the repetitive strain of these muscles is commonly seen in patients who play a lot of tennis or other racket sports. Overuse of these muscles can cause damage. As a result, micro tears may develop in the tendons, causing inflammation and pain. This pain and tenderness is felt on the outside of the elbow. Common locations for bursitis. Bursa are small fluid-filled sacs that cushion the bones, tendons, and muscles near your joints. This condition often occurs near joints that perform frequent repetitive motion. The hip, for example, is a common site for bursitis. Bursitis occurs when bursa become red and inflamed, causing pain.